Jane, I want to just come back and so Dave was speaking about never stopping still, never standing still. And Jane, I know you're looking forward, and the policy context at the moment is there's so much happening, isn't there? Jane, I mean, just any sense about some of the opportunities you see for GM in this emerging and rapidly changing policy context?
Yeah, in terms of opportunities, I think we're really looking to maximise those opportunities through devolution to kind of unlock the prevention dividend, which is something that Jenni's just talked about, and to address challenges across our system, but in health and care as well. And we're just reasserting our central mission as for city regions being one around growth and prevention, and we're developing a 10-year plan around that, and that will be aligned to our integrated settlement agreement, but we're also looking to go further. And at the heart of GM's approach is Live Well as a kind of core delivery vehicle. And Live Well is really centred on making a step change in integrated neighbourhood delivery and pivoting our system towards prevention to be able to respond more effectively towards demand and financial pressures. And that's really about, we've kind of coined the phrase everyday support in every neighbourhood. And this is about trying to radically shift in how we deliver public services so that we've got more collaboration with people and communities to really address health inequalities. And a core component of how we're going to work is the creation of Live Well centres and spaces in every locality, and actually looking at how we deliver holistic person-centred support from VCSE organisations and public services, but really based on what people need. So local person-centred preventative systems, social support, stability and security wherever people live. And three of the levers that we're kind of using for that is we're using DWP Trailblazer as a catalyst, including integrated settlement, and that we've got the only deal which incorporates health and care. We're also seeking opportunities through potentially being a national prevention demonstrator, very early conversations, and also PSR Pioneers funding. And that, going back to the themes we talked about earlier, that is about using the powers that we've already got, but seeking freedoms and flexibilities to do specific things, and also in order to build the evidence base. So that is really where we see as a city region we can kind of align with government ambitions. The DW Trailblazer is about redesigning that employment support, particularly around that cohort of the economically inactive. And it's about trying to provide, the devolution element of this is about providing flexible work, health skills, career development support to more people by using the same funding, but by integrating services within a place-based model. So we're looking to get something like 150,000 GM residents into work, taking our employment rates up from 75 to 80%, and looking at a model around supporting people into work that's got much more outreach and engagement, that for reaching people who wouldn't traditionally kind of access job centres. And we're trying to give job centres a different feel, and we're looking to relocate our kind of job centres, co-location with our Live Well centres, so that we're kind of changing the offer to something that's a lot more positive, that's a lot more supportive, that really is holistic.
Jane, that's fantastic. You're describing, Jane, the perfect nexus of being able to speak upwards to Westminster about what we need to be and what we can offer, but also to speak down to localities and communities about how to support them. So I guess that level of what it means to be a system, you've just been speaking, and I love the bit about testing out government ideas, showing government what works, public service reform and work and health, absolutely core parts of the agenda now, aren't they? So you're at the forefront of that. Jane, that is absolutely fantastic. Hold some of those thoughts there. We'll come back to some of them. Dave, we've spoken today about health in all policies and health policy. Jane was just talking about some of those issues now. Dave, do you see both of these as being pretty much at the forefront of what combined authorities and devolution is going to focus on?
I do, and again, it's always great following Jane, but it's always like, gosh, how can you follow some of that? But yes, and just to bring up, but there are some risks here, I think, too. Let's be frank about it. But and I'll come on to that. So we're doing a piece of work with the Centre for Local Economic Strategies at the moment about devolution, the opportunities in devolution, and particularly around health inequalities. And I guess. And so it's fascinating to hear, more from Jane and from Jenni as well. I'm sure, other people on the call will be very happy to sort of connect and get some of their experience too. I guess what we see, so we've done a little bit of background work, particularly looking at other countries too. So it feels like more devolution definitely can and does narrow economic inequalities. It doesn't necessarily, particularly from other countries, doesn't necessarily narrow health inequalities. It can do, but it doesn't necessarily. And this goes back to the intent. You have to do devolution with a focus on health and health reduction. Otherwise, it doesn't necessarily end up with health inequality reduction. And it comes back, I think, a bit to the question in the chat about business in the community. How do you engage business in from its own for its own purposes as well? Actually, it's great for businesses to have healthy, happy people. Is brilliant for business, isn't it? And great businesses are brilliant for healthy and happy people. So there's an obvious, very virtuous loop here, but it doesn't happen automatically, which is why it's so great to hear what's happening in Greater Manchester. But also, people aren't aware which is a bit of a boosted trailblazer, which are the health and growth accelerators, which are 3 other integrated care centres. You already mentioned one: South Yorkshire, West Yorkshire, North East, and North Cumbria. And there's been some really fascinating connections there between DWP, between the Treasury, between ONS and hospital episodes, all sorts of looking at how can we help prevent people falling out of work who have emerging health conditions or will get health conditions. So some really deep analytical work. And that both reinforces some things we already sort of know, which is musculoskeletal is really critical. So how do we help people stay in work with musculoskeletal problems? So how do we help manage and support their pain, etc., or change their jobs or whatever it may be? Mental health, particularly in younger people, and also obesity, to particularly severe obesity. But it also actually finds other connections, particularly to coronary vascular CVD, coronary vascular disease. So I think some of that really incredible analytical work, both done nationally and locally, can really help drive that connection between health and economic policy and goals and practice in local regions. But I'll be honest with you, maybe we're moving on here. There are some risks. So today we've obviously had, Keir Starmer's speech about the missions or about the plan, sorry. And obviously from the health side, that's waiting times. And the last Labour government did actually manage to make a huge impact on waiting times and make a difference on health inequalities. But it focused on them both. It didn't just focus on one. So there are some challenges about how national narratives and focuses, how are they translated into our integrated care systems and our combined authorities and local authorities too. The positive on that is we have a much more devolved system than we did in 1997 to 2010. I think the interesting and challenging thing is going to be is the national government going to try and command and control in some of these areas, and also between different parts of government, and how does that actually manifest itself in local areas? And so I think there are some real opportunities here, but also some things to be wary of and to try that we need to navigate.
Absolutely, Dave. Really good points. And the missions and the wider public service reform agenda is really important for this agenda too, isn't it, Dave? So we do need to make sure the crossover is happening there. Jenni, I want to bring you in partly about the question in the chat about how and where business might be featuring in the East Mids work, but also in your role in terms of housing. Really interesting that your role looks at housing, which is often falls between the public service and public sector perspectives, doesn't it, Jenni? So I'm really interested by how you're working with health colleagues and what the ambition is around housing. What can you achieve that perhaps wasn't possible without you in a combined authority?
Okay, so the housing one, there's elements of within our deal. We have funding for brownfield sites, so that's about bringing on some of the sites that have got stuck in the pipeline of developments, using funding to, I suppose, move those on. So that's almost quite an easy ask. It's none of it's easy, but it's easy in the sense that there's funding, the sites, join the two together, talk to the landowner, talk to the developers, get something moving. So that's what colleagues are working to. The bit I've been focusing on is almost the house as a home, and I suppose the side of homelessness. So I've been doing a big study into homelessness, which is what the Mayor had a real focus on. And I suppose I've come to the conclusion of that actually, even if you gave everyone a roof over their heads, you would still have people who are homeless, because to stop homelessness, you need to have all the infrastructure in place to support people. So it's not just about having enough houses for people to live in, it is about having those support structures, which means everything from how you sort of move out of your house, so the transport links, the accessibility, are there enough jobs, how does your benefits work, where do your kids go to school, where do you go to the local shop. So the whole of the infrastructure that builds around the houses and creates a sense of place, where do you be, where do you belong, and then how do you actually live in those homes, how can you afford to live. So I think businesses are really key in that, because actually they are often the areas that people really identify with the business, and especially in some of the East Midlands region, we have some really well-known mega businesses, so like Rolls-Royce or Toyota, that almost take over whole areas of both the buildings that those businesses are located in, but in terms of the workers who are working in them. You've then also got sort of smaller, still massive, but like Sports Direct, that has a lot of low-paid workers that are less skilled, brings a really different context to the areas around where Sports Direct are based in terms of their big warehousing. And again, people's ability to not just survive, but also thrive within a lifestyle and a life chance. So I think, it's an area that we're trying to grow and develop. So we know we need, masses more houses. But I think for me, it's not just about houses. It's, have we got the houses in the right place at the right time? Are we actually talking to people about having conversations about where do they want to be? So how do they want to live well? How do they want to age well? How do people start helping themselves to think about the future? What does the future look like for people? So, we have the populations now that we have to deal with, but I actually keep trying to bring people back about what's coming upstream, what's behind us. So, sort of younger generations, are they actually going to be afford to have houses? Are they going to afford rent? They're not going to have the asset to pay for care when they get older. So how are we as a society gearing ourselves up for trying to deal with those generational growths in populations? So I think it is, small steps. So there's just another question come up. How can health promote housing solutions to authority? I think, Ian, your question is really true. I think there are lots of ways that we can work together. I think some of that is about how you actually build the housing to make sure that they're good housing for life. So they actually support good health and well-being. And then I think it is very much about how you start to build greater synergies with the organisations where that housing is. That isn't giving you justice to your answer to your question, but I realise we're short of time.
I suspect, I know, we could take a whole more than an hour, Jenny, talking about this, and that's the point of devolution, is to cover these issues actually in much more detail. So we look forward to following your journey in the East Mids on housing, Jenny. I know there's a question in the chat about, before I hand back to Julia, about boundaries. I think the one thing I would say about footprints, I don't want to start hairs running, is I understand government would like the map of sub-regional governance to have some level of coterminosity across public sectors. Now, that is easier said than done, so we'll have to wait and see what the white paper says about whether footprints will be opened and reframed, but clearly some people in Westminster would like to see a more standardised approach. I know there's questions we haven't quite got back to. Julia, I suspect we need several more of these, and the word devolving, Julie. This is a constant conversation, isn't it, Julia? So how do we support people going forward on this, I guess, is my final question. But Julia, thanks. Before I hand back, just thanks to the panel, Dave, Jane, Jenny. I thought they were absolutely fantastic discussions.